You always have a little fear.
Yeah, that is so
But
true.
you have to you conquer it, and you do your best, and that's all you can do.
Yes.
If you do your best, and you have good intentions, and you follow protocol, then you know that you did everything you could. You'll be able to sleep at night.
Okay. You're making me...
Treat every patient like if the patient was your relative.
That is really nice.
That patient is somebody's mother, is somebody's aunt, somebody's sister. If you're doing, male patients, somebody's brother, somebody's son. So just look at the exam like if that exam was being done on someone you love, because somebody loves that person. So if you look at it that way, then you're going to do everything you can. And then you'll be able to sleep at night. If something happens, nobody's perfect.
Yeah.
But at least you know that you did everything you could for that patient.
Yeah.
Because you treated that patient like a relative of your own.
Yeah. That is awesome. You're making me feel very confident about my decision. Thank you. Thank you. So the next question is, how did you land this current position?
I purchased my own equipment. You want to talk about being scared. I purchased my own equipment, and I hustled to get accounts to open up my own business and be an independent contractor doing what I do.
Equipment.
At the hospital, I did an internship, and I got the job. I got an internship doing surgical tech stuff because I started as a surgical tech. And as the years went on and the time went on, then I started doing ultrasound, and I started doing this, and I started doing that because I like to learn. And when I decided to go back to school, 5 years into my job, I decided to go for ultrasound because out of all the things that I was doing, that was what I liked the most.
Okay. Okay, and next question is, what do you enjoy most about your job?
I'm fascinated by the anatomy. Now, a lot of people don't like OB. And I don't know if you've seen that while you're doing your internships, a lot of people don't like OB. Because OB, you have to chase someone to get your exam done. That baby is not going to be in the same position all the time for every patient. And you are scanning an entire person. It's not like scanning a liver or a kidney. So that part of it, because I'm fascinated by the anatomy, I like that portion of my job. I also do GYN, but, GYN is uterus and ovaries. So I'm fascinated by all that. I would say that besides the scientific portion of it, I like the feeling of when somebody leaves my room and they left with a nice experience. That doesn't always happen because some patients are just bitches, and there's nothing you can do about that. That has nothing to do with you. That has to do with them.
Yeah.
I actually feel kind of sorry for those patients because they live their life like that. Amargado,
Sí.
Pero yo solamente tengo que estar con ellos media hora, 15 minutos, dependiendo del examen. So I'll deal with it for 30 minutes, 15 minutes, for however long the exam is. But when you get that patient, whether it's a GYN or, the patient that really wants the baby and they really wanted a girl or they really wanted a boy, or they just happy to know that the baby's healthy, or, a GYN patient and they had a really bad experience somewhere else, and then they come and see me and they're like, oh my God, this was the best ultrasound I ever had. That's really nice. That makes me feel really good about what I do.
That's so nice. And do you work as a team or as an independent? Independent. Okay.
When I was at the hospital, I worked with a group of sonographers. But I worked night shift, and it wasn't like a group. I don't want to say a group of sonographers. It was maybe like two of us on the team. It was me and this other girl that did it. When I wasn't there, she did it, and when she wasn't there, I did it. I worked labor and delivery.
Oh, that's what I want to do.
Okay, well, I worked labor and delivery, and you won't be able to find too much stuff. The place that I worked at, they closed the unit.
Oh.
After I left, thank God that I did what I did, because I was going to have a job. But after I left, they closed the unit. So I don't know if you'll find a lot of places that have ultrasound on the same floor as labor and delivery.
Yeah.
You know what I'm saying?
Mm-hmm.
You probably have to go to like a clinic that does OB or GYN or something like that.
Okay.
It doesn't, or you can work at the hospital and do everything.
Yeah.
I worked night shift and I liked night shift.
Mm-hmm.
I worked from 7 p to 7 a, 3 to 4 days out of the week.
3 to 4 days. Okay.
Yeah. And I liked it. It's a different kind of people. We were more laid back. And day shift can be a little uptight sometimes.
Yeah, hectic. What hospital did you work?
I worked for OHS, for the same hospital as Winnie Palmer, but I worked in South Central Hospital.
Okay.
And it was a small unit, and I guess when Winnie Palmer opened up, it took a lot of business, labor and delivery business from them, and they didn't have a choice but to close it down. That was what I heard. I wasn't part of it anymore, so I wasn't there to see it for myself. But that's what some of the nurses that I still keep in touch with told me.
Okay. And what was your major when you went to school?
I got an associate's degree in science by the time I was done.
Okay. That is awesome. And
are you in the program now? Or are you trying to get into the program?
I'm trying to get into a program.
Okay.
And I'm going to Valencia for my pre-rights, and then I'm trying to move to Adventist University, which is the Florida Hospital College.
Mm-hmm.
So I'm trying to go there because it's really good school, and, you know, automatically you do get a job with the hospital.
Mm-hmm.
But it's really hard to get in, but I hope I do get in and finish it there.
It's difficult, but just keep trying. Don't give up, because, you know, if it was easy, everybody would do it.
Uh-huh. Yep.
And at the end of it, 2 years later, you're going to have a career. Mm-hmm. And 2 years in the span of your life is nothing.
Yep.
That's a small investment into your future so that you can do what you want to do. Because in order to do what you want to do, you have to do it. You got to do what you have to do in order to do what you want to do. You know what I'm saying?
Yeah.
You have to make the sacrifices in order to reap from the benefits of your work.
Mhm. That is true. And
so just keep trying. Don't give up. They're gonna have to accept you eventually.
Yep, that is true. And what college or university did you attend?
I went to Kaiser College in Daytona Beach. At the ultrasound program, there's 3 places that are accredited. Don't go to a school that's not accredited.
Okay.
Because you're going to have a hard time finding a job.
Mhm. Yeah, that's the most complicated thing to find out, because you see so many that are not accredited for this program.
Florida Hospital is accredited. Valencia is accredited. And the last I knew, Kaiser was accredited, the one in Daytona Beach. But I think 2 years after I was out of there, I had heard that their accreditation was on probation.
Okay.
So you can call SDMS. You can look them up on Google. That's Society of Diagnostic Medical Sonographers. And call ARDMS, which is American Registry of Diagnostic Medical Sonographers. You can call them and ask them if that school is still accredited or what school is accredited.
Okay. I'm making a little note right here. Great. That's going to help me.
Yeah,
really
make
good.
your calls and do your research, because it's not cheap, and you don't want to invest your money in a school. And when the time you get out, you're going to be right back where you started.
I know, yes.
Y el dinero es el dinero, uno lo pierde y lo gana, pero el tiempo, cuando tú pasas eso, tú no lo puedes ganar para atrás.
Sí, Yo acabo de cumplir 18, so vamos a ver si cuando termine tengo 19, bueno, en 20, 21, así.
Pues you're on the right track, pues está pensando en el futuro. Y eso, that's a great thing for you to figure out exactly what you want to do and go for it.
Yeah.
Empieza tempranito. I started the same way you did. I went to college and I said, look, I don't want to be here for 6 years. I need a job, but I don't want to work at the mall. So what do you got?
Yep, exactly. That's exactly how I feel.
So I did the surgical tech program. I was done with college by the time I was 19.
Oh, wow.
And then from there I got the job at the hospital, and then a few years into that I went back to school again. Once I figured out exactly what I wanted, but I already had my foot in the door.
Yep, you were already in there.
Yeah, so, and, just do your research, and, you know Nina, you can always call the office. I'm here every Tuesday.
Okay, thank you.
Okay, cualquier cosita, pues ya, si tienes preguntas, no te preocupes. You don't need a homework assignment to give us a call and find out.
No, thank you. Thank you so much.
You're welcome, Mama. Was that the last question?
Déjame ver. Nope, that was it. It.
Okay, Mamita. Well, have a great day.
You too. Thank you so much.
You're welcome. Enjoy.
Thank you. Bye-bye.